Thank you again for joining us today. Today's event will share further details on the new project, eligibility requirements to participate, details regarding the application process, as well as an overview of the technical assistance that will be provided to selected participants. With that being shared, I'd like to welcome the Center's CEO, Sally Buck, to kick off today's webinar. Thank you for joining us and welcome, Sally. I will now turn the presentation over to you.
Hello, and welcome to the Rural Healthcare Provider Transition Project Kickoff webinar. I'm Sally Buck, CEO and Principal Investigator for the project, and I'll be opening today's webinar, and we're excited to share the details with our state and national partners today before we have the informational webinar on Thursday for hospitals and clinics. The National Rural Health Resource Center is a nonprofit organization, and we are dedicated to sustaining and improving healthcare in rural communities. We have been providing services for nearly 30 years and collaborated with the Federal Office of Rural Health Policy at HRSA for over 20 years in various rural health programs, primarily providing technical assistance and providing knowledge in the areas of rural health. The center focuses on 5 core areas, and that includes the transition to value and population health. And one of the programs we've worked with over 20 years is the Medicare Rural Hospital Flexibility Grant Program, or FLEX, providing technical assistance to the 45 states with critical access hospitals. Also, we provide technical assistance to the Small Rural Hospital Improvement Program, or SHIP, that supports small rural hospitals with the transition to value and into ACOs and with prospective payment systems. Another example is managing the Delta Region Community Health System Development Program, working with rural communities in the Delta area to address health needs and strengthen local healthcare system through comprehensive technical assistance. We also work in the area of collaboration and partnership and provide network technical assistance for several years through the Federal Office of Rural Health Policy, and work with directly with rural health networks. Performance improvement, providing strategic planning, balanced scorecard development, either at the hospital network or state office of rural health or hospital association level. HIT, or health information technology and telehealth, that has been a focused area actually since 2006, and we chair the National Rural HIT Coalition. And finally, workforce. And the center started in recruitment and retention 3 decades ago in Minnesota, but supports state offices and networks with workforce, as well as leadership development now in several of the programs. Well, today's agenda, as you can see, we're focusing on who is the center and how we will be working with the Federal Office of Rural Health Policy to implement this new program, the purpose behind the Rural Healthcare Provider Transition Program, eligibility, benefits, the timelines, how to apply, and how the selection will happen, and finally, educational opportunities that will be available through the project. The team includes myself, Terry Hill, Senior Advisor for Rural Health Leadership and Policy, and Terry will be assisting with technical assistance, project design, in our advisory committee. Bethany Adams, the Program Director, will be serving with project assessment and evaluation as we track our outcomes for this 5-year project. Rhonda Barkus, Program Manager, works closely with Janine Myers, our project officer at the federal office, and also guiding our work plan. Angie LaFlamme, program specialist, will be providing technical assistance for the selected sites and developing education and resources. And Kiona Hermanson, program coordinator, will be coordinating all of our outreach, communication, webinars, learning collaborative, and website. I'd like to introduce Janine Myers, our project officer at the Federal Office of Rural Health Policy for this project. And Janine brings years of wisdom and experience from serving in the hospital state division for several years and leading Small Rural Hospital Transitions Project and the SHIP program, as well as the Rural Healthcare Improvement Program, or RHPI. Janine?
Yeah, hi, everyone. I just wanted to take a minute to say good afternoon and to thank each of you for making time to join today's webinar. We are really excited in the federal office about this new program, an opportunity to work with both rural health clinics and hospitals together. And just looking forward to being able to share with you the details of the program today. And I also like to thank you guys for your continued support of FORT programs and ask that you would continue to partner with us in this new effort by assisting us in sharing information about this program with your small rural hospitals and your RHCs. And I guess I will shut up now. I said, no, we have covered, so I will just pass it back to the center team. Thanks so much.
Well, thanks, Janine. And we always are open to hearing your advice and wisdom, and been a wonderful guidance in launching this new program. And this program moves into working with hospitals in the transition to value following the Small Rural Hospital Transitions Project, or SHRT. And that project worked with 52 selected hospital projects, as you can see on the map there, from 2014 to 2019. And that program was focused on hospitals 49 beds or less in areas of persistent poverty. So it was not open nationwide as this new project is. The SHRT program was included hospitals eligible in 19 states, and that funding was provided from FORHP. And a few outcomes that we wanted to share on the impact of that technical assistance, because that really is providing us a framework for this new project, which has a different elements in the technical assistance, but is looking at the same goal of moving providers in terms of their readiness to be able to participate in advanced payment models. And some impacts of the SHRT technical assistance included that we were working with 52 projects across 19 states in the direct technical assistance. And from those financial, operational quality improvement projects, we were able to do follow-up interviews and gather follow-up data. And we found hospitals increased days cash on hand, their patient satisfaction scores improved, as well as days in accounts receivable improved. They reduced readmissions and recognized savings from 340B program. And in the 2020 return on community investment analysis, we found a $7.43 return for every dollar invested in consultations overall for the project. And for the education components, which included learning collaboratives and webinars, $1.97 return for those educational components. It didn't include any direct virtual or previously on-site technical assistance. A feedback assessment with those hospitals found that 88% strongly agreed they'd recommend participation in the transition project. And finally, 120 resources were created through SHRT over that 6-year time period. So what is possible? Well, one of our participating hospitals from SHRT shared this feedback on the project in terms of their improvement in quality, patient satisfaction scores, and feeling that that really set them apart in their region. And we gather success stories and create spotlight video segments, and these are 4 that were created in the SHRP project, as well as hospital spotlight profiles, which are listed on the website. So those are showcased to see some of the types of past projects offered from the Federal Office of Rural Health Policy in the transition to value. Well, the purpose of the Rural Healthcare Provider Transition Project, which is a mouthful, so we refer to it as the RHPT program. So if you hear us refer to that, or shortened acronym for the time being. And this program was awarded to the center after a competitive application. And we received the award in August 2020 as a 5-year cooperative agreement. The purpose, it's designed to support small rural hospitals and certified rural health clinics to help strengthen their foundation in key elements of value-based care, including efficiency, quality, patient experience, and safety of care. And the other purpose is this will help guide those providers not currently participating in value-based care to prepare for and position their organizations to be effective participants in a health system focused on value. Now I'll turn it over to Rhonda, who's going to talk about the eligibility for small rural hospitals and rural health clinics to apply and participate in RHPT.
All right. Thank you, Sally. And thank you all for being here and helping to share this with rural hospitals and also with the rural health clinics. We really appreciate your support in getting the word out there and letting folks know, because Thursday will be the webinar for folks who are interested in this project. So 3 main pieces to the eligibility. There are a few other pieces of information which we encourage you to go to the link that is specifically around eligibility. But the first piece of eligibility is it's small rural hospital, if it's a hospital that's applying. And so as you all know, small rural hospital, it's located in either the rural area, has 49 beds and less, according to the most recent filed Medicare cost report. The rural area specifically, there is, it would either be one that's located outside of a metropolitan statistical area, or is located within a rural census tract that is part of an MSA, and or is being treated as if it's located in a rural area pursuant to 42 USC. If you all have any problems at all figuring out like who's eligible, who's not, please let us know and we can help out with that. Also, eligible SHIP hospitals may be for-profit or not-for-profit, including faith-based, and hospitals in U.S. territories as well as tribally operated hospitals are eligible if they meet the above criteria. So we are opening this application process to a different variety of combinations of how folks might decide to apply. So there are 4 different options. The first one is that a small rural hospital and a certified rural health clinic apply together under one application. So the technical assistance would be supported to both of them together under one application. Or a small rural hospital could apply alone, or a certified rural health clinic could apply alone, or a consortium of certified rural health clinics could apply together. So there are those 4 options, and each option, as one of the first questions in the application is which option are they applying under, and then depending on the answer, that will take them directly to the questions that are related to the option that they chose. And also, I will say that, because I've had this question a few times already, does this include independent rural health clinics? And it does. It could be a provider-based or independent as long as they're certified. So what the technical assistance is going to look like. Each year, 5 hospitals and clinics, so 5 of those 4 kinds of applicants will be selected to receive the on-site virtual. So this year it's going to be virtual. Next year we're hoping we will be on-site for some of it. The technical assistance. And so the services include the consultations and coaching that will support the implementation of the best practices and helping to transition to value-based care strategies. We'll have you guys in just a moment meet some of the consultants we'll be working with, Stratis as well as Stroudwater. Stratis is going to be supporting the clinical areas of focus that will include efficiency, quality, patient experience, and safety of care. And then Stroudwater is going to be doing an assessment for your organization's readiness for assuming risk. In addition to that, those 2 pieces of individualized TA, all of the healthcare providers will be participating in a learning collaborative, which will be a series of webinars that are very interactive and help to support project implementation and sustainability. We will also be rolling out 6 to 8 help webinars, and we will be encouraging you all to participate in those or to access the playbacks. And then the last thing that we always do to capture outcomes, we have a process that's called recommendation adoption progress, and that's 2 calls that helps with the implementation following the consultation. All right, so I am going to pause here and hand this over to Stratis for just a moment to introduce yourselves and talk a little bit about your TA for the folks that are going to be participating. Is that Carla or Carrie?
Thanks, Rhonda. It's Carla today.
Great.
So thank you. We're really excited to be part of this new program with the center and be partnering with the center and Stroudwater on this effort. I know lots of the names that I see in the participant list. So some of you are probably familiar with Stratis Health. We are a nonprofit organization that leads collaboration and innovation in healthcare quality and safety, as well as facilitating improvement for people in communities. We have a long history of working with critical access hospitals, rural health clinics, and other rural providers. And at our kind of heart and core of our organizations is that we serve as a quality improvement organization. So really excited about the opportunity to be working on the variety of strategies that have been outlined in this space, because it really plays to a lot of the deep expertise that we have as an organization. The next slide will give you kind of our core team that will be interacting with the RHPT program, although we do have a good handful of other experts and subject matter experts that we're going to be able to draw on. Some of you are probably familiar with Sarah Brinkman. She has been a lead for the Rural Quality Improvement Technical Assistance work for Stratis Health, and then also has a history of working with the FLEX program. Sarah also does a lot of work with the QPP SIRS, with the Small Rural Underserved Technical Assistance, and has a background in working on patient experience and other hospital and clinic quality improvement. So we're excited to have her expertise. I'm super excited to introduce this group to Carrie Howard, though most of you are probably familiar with Sarah. Carrie may be a new face to you. She's not a new face to Stratis Health. She's actually been with us for the past couple of years, providing pretty intensive technical assistance to the Indian Health Service hospitals here in Minnesota, and then also working more broadly with Indian Health Service hospitals as part of the Partnership to Advance Tribal Health, so the PATH program. And then Carrie also has a background in working at a hospital and health system level in quality improvement. So the 2 of them are going to be a fantastic pair. I'm excited to get to be part of the team as well. I have a long background in working in a variety of quality improvement efforts, and I'm also part of the Rural Health Value Team, which has been focused on value-based payment in rural. So those are kind of the different lenses and expertises that we'll bring to play. Our primary role is on the next slide. We will be working specifically with the 5 selected hospitals and are building out some technical assistance tracks specific to either embedding improvement into everyday practice, improving patient safety culture, improving coordination of care, and improving patient experience and engagement. So we recognize that to develop and be successful in value-based payment arrangements, you really need to kind of look across all of these. But because of the somewhat short timeline that we'll have to be working more intensive, we'll kind of focus in on one of these, have an assessment that helps the organizations identify key focus areas, but also helps give them a roadmap to next steps. So really excited about the opportunity to potentially work with the hospital clinic pairs or groupings, but also individually with rural health clinics or small rural hospitals to line this up. So we'll be doing that work and then also supporting the center as they're working more broadly with the learning, the collaborative, and the help webinars. So thanks, Rhonda.
Okay. All right. Thanks, Carla. And so the other group that will be working with us is Stroudwater. And I think I saw that Lindsay is on. So Lindsay, do you want to say a little bit about Stroudwater?
Sure. Thanks, Rhonda. So good afternoon, everyone. So I'm Lindsay Corcoran and I'm with Stroudwater Associates, and I'm sure many of you have heard of us, but just by way of background, we are a healthcare consulting firm. We primarily, the team that you see in front of you here on the slides primarily works with our rural hospital clients, doing a lot of, in the kind of the buckets of finance, operations, and strategy. We do a lot of work in addition on the clinical side and quality side as well. So these, Eric is our longstanding rural lead and will be the main partner in this project, and then supported by myself and a former CFO of a critical access hospital, Dan Gibbon. So Stroudwater's role in this project is on the financial side, and we'll be performing financial risk assessments for the organizations who are selected, really to understand the financial risk, identify any strategies, and develop tactics to participate in some of these value-based care payment arrangements. Some of the components of the financial risk assessment will look at kind of the financial strength of the organization, looking at balance sheet liquidity and your income statement performance from a historical perspective, to ensure that you will be able to participate in a value-based care arrangement from the financial side, looking at your provider arrangements and alignment, as well as if you are already participating in any type of pay performance type contracts, and what do those look like, in addition to components related to your market. Some of the outcomes for that risk assessment would be the improvement opportunities from a financial perspective for your organization. What is the upfront and ongoing investment to be participate in a value-based care payment arrangement? And as Rhonda had mentioned earlier, what is that risk that's associated with these programs as well? For organizations, will have to submit a data request as part of this assessment. We will be holding stakeholder interview calls, and there'll be a stakeholder review meeting that would go over the assessment and develop a action plan for implementation. Stroudwater will also support the learning collaborative activities and provide, education as well as technical assistance for the other participating rural hospitals and clinics.
Okay, thanks, Lindsay. I appreciate it. Glad you could join us. All right, so there are two pieces to the RHPT project. So the one that we talked about just now are the 5 selected organizations or applicant organizations that get that very intensive TA. In addition to that, though, we are also going to be choosing 20 other applicants, hospital clinics, either standalone or together, to receive virtual TA through the Learning Collaborative that has been spoken about a little bit. And the idea behind this Learning Collaborative is to really help the organizations to learn the tools that can help move towards value-based care, to get the peer-to-peer support, the education, and prepare them in case next year, if the hospitals or clinics would like to apply again for the that more intense 5 organizations, then this would prepare them to have maybe a stronger application. Also, this cohort will be able to, of course, access the help webinars that are going to be on a variety of topics on advanced care payment models and value-based care topics. So 2 different opportunities for hospitals and clinics to participate. So a few project expectations, and again, all of this is listed out on our website. Selected organizations have to be ready, willing, and able to really undertake and participate in the comprehensive consultations project, especially for those who are part of the group of 5 for the intensive TA. If for some reason we get started and the hospital or clinic are not able to meet project deadlines like data request and those kinds of things, then we will go ahead and place them back in queue for future consideration, and we will move on to the next ready applicant. So some information about the application. The application will go live tomorrow and is going to be, applications will be accepted from tomorrow through January 15th. After we select this first cohort of 5 hospitals and then the 20 that are getting the Learning Collaborative support, after that we will reopen the application process up, or the application up, so that hospitals and clinics could actually go ahead and fill out an application at any point. So that will be open, be more of a rolling application, and we will be able to go ahead and start looking at applicants for next year, go ahead and do interviews and things like that. Also, we've created a project application guide, which we encourage all the applicants to take a look at, go ahead and start getting their thoughts together about some of the questions so that they're prepared before they start filling out their application, because once they start filling out the application, they will not be able to save work. So we are encouraging them to use the application guide first. So the application includes 2 different parts. First, when the applicant goes on, they'll do a pre-application screening. This is just to make sure that they are indeed eligible for this project, because we wouldn't want somebody to fill out the application only to find out they weren't even eligible. That part 1 will be done by the lead organization, whoever that would be. Very often, if it's the hospital and the clinic applying together, that would be the hospital. And then if there are any additional organizations that should be considered part of that application, there's an opportunity to define who those folks are and whether or not folks from another organization need to help fill out the application as well. Part 2 is the meat of the application. So once we've determined that, yes, you are absolutely eligible, then it will take that person to part 2, which is more about the details, name, address, those kinds of things. And then the organizational readiness, which is determined by 7 open-ended questions. And this is going to assess the organization's past and current efforts towards preparing for value-based care. These 7 questions are the ones that will be scored. The questions are very clear about what we're looking for in the information, and we'll also let the applicant know how many possible points they can get for the answer to that item. Okay. All right, so once we have completed the application process, we have closed those applications, we will start scoring those. That's going to be done by us at the center. And again, it's going to be based on those open-ended questions and the responses to those. Also, we will be giving 2 preference points to the total score for any certified independent RHC and hospital that applies together under one application. Once we go through and finish the scoring, we will look at the top 10 highest scoring applicants, and we will contact those folks and do a virtual interview via Zoom, and that will be required to be considered for those 5 TA spots. So the Zoom meeting is just a chance for us to dive a little deeper into some of the application questions. We won't be asking them anything that's not on the application, but it'll just be to help us to clarify. And then from there, we will take the application and the interview information together and identify the 5 applicants that are most likely to benefit from that very focused TA. And then again, up to 20 additional applicants will be invited to participate in the virtual learning TA. And this is just a look at our website, eligibility and application. It also includes, it includes the RHPTP eligibility, the application guide, and we'll also include the opportunity to look at the questions in advance. And then we do encourage the applicants to go ahead and fill out the application guide questions. And then so if they download the Word document, they could actually go ahead and put in their responses to each question so that when they go to the application itself, they can just copy and paste from the application guide so that they're prepared for filling out the application. Additional resources that will be coming soon. Again, everybody, whether they, small rural hospitals and the rural health clinics are all invited to be part of the HELP webinar series. And everybody will be invited to participate in the webinar regardless of whether or not they submitted an application for TA. The other thing that you will see coming soon is the Value-Based Care Preparedness Toolkit. Anybody who is familiar with the Small Rural Hospital Transition Project that Sally had mentioned earlier, then you might be familiar with the toolkit that was called Rural Hospital Toolkit for Transitioning to Value-Based System. So we are going to be updating that toolkit, adding some new areas that are really pertinent to this project, and then we will be renaming that. All right, so I am going to pause right there and see what kinds of questions that you all might have. And Kiona, I don't know if you can take a look at the chat box and see what kinds of questions we might have there.
We do have one that came in. So the question is, some CAUs are designated as rural by their state, yet not considered rural by FORA. Are such hospitals still eligible to apply for RHPT?
So I would need, what we will do is put that in the facts part, because it depends on going in and looking at the eligibility, because I know that there are some that are, again, not considered rural, but they are considered to be a rural census tract, even though they're metro. So we could certainly assist with helping them, the hospitals, to figure that out. Terry, Janine, Carla, anybody have anything else to chime in on that one?
Yeah, this is Terry. I think we'd have to take a look at it on an individual basis. It would seem to me if they're a critical access hospital, almost by definition, they're in rural, but it really is going to depend on how Janine sees it. And I think we'll have to just take a look at it individually.
Mm-hmm. Yeah, and if anybody wants to apply and they're not quite sure, I think the best thing would be just to contact us and we can have a quick phone call with them and we can go through the links where we can figure that out together. Because I know I was looking at one today and it looked like they were not eligible, even though they were a critical access hospital. Kiona, other questions?
That was our one question that came in.
Okay. So before we wrap up then, does anybody want to unmute and ask a question? You're certainly welcome to do that if you didn't want to put it in the chat box.
Oh, hi, my name's Dorothy. I'm calling in from the New York State Office of Rural Health. Mm-hmm. So I was the one that asked that earlier question. So we do have one hospital that is interested. How would they be, what's the best way for them to set up that teleconference with your office?
So if they will go ahead and just email me, or they can actually also call, but you can see we have the ripped inbox down below, the RHPTP at ruralcenter.org. That would probably be the best thing to do. And then we could just set up a time to talk that through.
All right, thank you.
Sure. All right, any other questions?
Rhonda, I'll make a comment here, and that is this program has about 20 years experience working with rural hospitals in various versions. This is the first one, as you said, that really opens it up to hospitals nationwide. And I've worked with, over the 30 years plus of my career, I've worked with hospitals, rural hospitals in every state. I may be prejudiced on this, but I think this is one of the best programs I've ever seen with federal funding. It's got documented results. It takes it into account, really, you have to work with rural hospitals to really understand them and understand when they're super busy or, so, we've really tried over the years, we've been on a continuous improvement mode. And as you and Janine and our other speakers, I really share the excitement on this program. I think we're moving, it will help to move hospitals into position to do well in value-based programs if they choose to do so. So I just wanted to make that comment. I've worked with so many different federal programs, and this is absolutely one of my favorites.
Thanks, Terry. And also, we're really excited to get to work with rural health clinics for the first time. Okay. Any other questions? No. Well, thank you again, everybody, for your support of us and this project and helping getting the word out to your hospitals and clinics, because we are certainly relying on you to let them know that this is available. Also, let them know that Thursday will be the webinar to provide information to them. And if you have any questions at all, please feel free to reach out to us. This recording will be on our website very shortly, in case there's anybody that you know of that wasn't able to attend today. But let us know any questions, and thank you again, everybody, for coming on this Monday afternoon. So everybody have a good day. Thank you.